Hi, I'm Dr. Sian Cole, Senior Health Psychologist, and this is a video on learning the technique called nightmare rescripting. So it's very often for people to have recurrent nightmares that they find really challenging and affects their ability to sleep. So this skill is to actually help people learn how rescripting their nightmare can actually help ease the recurrence of these nightmares. So step one, first thing to do is learn how to do a calm breathing technique. I've got a simple calm breathing technique on a video that I've already posted, so you can just do a search for calm breathing. But also other breathing techniques that actually help calm the breath down is progressive muscle relaxation, or my favorite, mindfulness of the breath. Also in this first step, make sure that you are ready to do this. You can ask yourself, is now the right time to be trying this skill? And how willing you are to do it as well. You can think of any extra skills, supports, or resources that you might need to put in place before starting. And also know that you do have to give this skill time to work. It does take practice and unfortunately it won't happen straight away, but there are a lot of positive outcomes with learning this skill. All right, so you're ready to give it a go. So this step is thinking about which recurring nightmare you would like to work on. And this will be your target nightmare. Now it needs to be a recurring nightmare, something that happens regularly, because this rescripting the nightmare is about kind of changing the neural pathways in your brain. It's kind of rewiring them. So it has to be something that your brain is kind of stuck in doing and giving you. And it is quite common for people to have the same kind of recurring nightmare or same similar themes as well. So select a nightmare that you can manage now. There might be some trauma nightmares that you might want to work on them after you've learnt to do it on another kind of nightmare that might not be so traumatic. If it is the nightmare that's recurring, then we'll go on to the next step. So let's write down your nightmare. And I do want you to include as much description as you can. You're making it the story. So use any of those sensory descriptions and also any thoughts or feelings that you're having in this dream as well. So for example, if you've got a nightmare that you're trapped, you might want to describe it as dark and dank, smells, wet. You bring all those kind of, yucky kind of sensations that you have associated with that nightmare. And then any of those thoughts and feelings, you're feeling scared, having thoughts, I can't get away, anything that you're kind of thinking as well that's making it really a scary nightmare. You worry about not being able to rescue people or save yourself. So for the next step after you've written out your nightmare is to actually choose a changed outcome, a changed ending. And this change should occur before anything really traumatic or bad happens to you or others. So what we're trying to do is kind of teach your brain how to come up with a different ending that is not going to be associated with the usual nightmare, and actually makes you feel more like at peace. Now, the good thing about dealing with dreams and nightmares is that it can be very unusual, and anything that can happen in your dream. So, you might be feeling trapped and you find a key, and that kind of makes sense. But if you want to, you can have superhuman powers that can help you escape to safety or fight people off, or a superhero can come in and rescue you. You can really be as, creative as you want, as long as it makes you feel a sense of peace and happens before the actual traumatic event or the bad thing happens. And also, again, include changes in your thoughts and feelings and assumptions as well in this step. And lastly, with step 5, you write down this full nightmare with the changes. And now what we're going to do is you're going to rehearse that. Read that new story every night before going to bed, and do the relaxation practices as well, and just kind of helping the brain learn the new script, really. So it's also good to be doing the rehearsing, reading the story, visualizing as much of the dream as you can, even during the day. The more you get those neurons to fire together, the more likely they're going to wire together. And the recurring dream, those neurons will fall apart. And, or maybe falling apart is not the best visualization, but the neurons will lose their connections with each other. And you'll strengthen the connections with the other ones with a new ending. So read every day, practice your relaxation, getting into that rest and digest rather than that fight flight mode, as you can see in my mind body stress response video. And that's it. That's the practice that it takes. So now it's up to you to practice that every day. And it really has great outcomes with so many of the people that I work with. So keep up, give it a go, and thanks for watching.